All right. Good morning or close to good afternoon. Welcome, everyone. This is informational briefing of the Committee on Energy and Environmental Protection. It's our first meeting of our new committee, so maybe we'll quickly do some introductions. First of all, I guess we're here. It is Wednesday, December 21st at 10 a.m. And this is a virtual only hearing that's also being live streamed onto YouTube. And it will also be available on YouTube afterwards to watch back. It will be there on the Hawaii House of Representatives YouTube channel. And I am Nicole Lowen. I represent House District 6 and chair this committee. I'll pass it over to my new vice chair, Rep. Cochran from Maui. Do you want to introduce yourself?
Hi, good morning, everyone. Can you hear me okay? Aloha. Yeah, I'm happy to be here and thank you. And I represent House District 14. It's a sort of newly created district. I've taken over, so to speak, Angus McKelvey's position in the House. But this district now incorporates not only what the past House District 10 did, but now includes parts of Wai'ehu, all of Waihe'e, and Kahakuloa. So the House District 14 is a little bigger district, but happy to be here and extremely excited and honored to be the vice chair of this particular committee. So mahalo, everyone.
Thank you. And then we're joined also by Rep. Kahaloa, who's my neighboring rep. If you want to introduce, I don't know if anyone's there on video. If you want to introduce yourself, you can turn your video on. Otherwise, I'll just announce people's names, I guess. And then we're also joined by Representative Ward.
Good morning, everybody, and welcome to the new freshman. This is going to be interesting. I'm your minority member from Hawaii Kai. I look forward to the session.
And welcome to the committee. And then also not present, also on the committee are Rep. Gates, Rep. Woodson, and then Rep. Amy Peruso, who might join us a little later. And then we also have joining us some members of the Health Committee and Water and Land Committee. We just extended the invitation to those committees because they also overlap. So I see Rep. Poi Poi and Rep. Amato. I don't know if either of you want to turn your cameras on and introduce yourself. You can if you want to. Now's your chance. Okay, if not, we will go ahead and get started. So we have two presentations today. Dr. Diana Felton from the State Department of Health and Dr. Elizabeth Kiefer from JABSM, who is a assistant clinical professor of medicine. I think our first presentation will be from Dr. Felton. She's the state toxicologist at Department of Health. And I guess I'll let you tell us a little bit more about your background if you want to do that. So we'll go ahead and turn it over to you if you're ready to get started, and feel free to share your screen.
Sounds great. Thanks, Rep. Lowen. Actually, Dr. Kiefer and I are here together, and we're going to be sort of giving a combined presentation going through this extensive topic. So I'll go ahead and start sharing the screen.
And, I meant to also say, sorry, I kind of jumped right in there. The reason for this informational briefing, we talk a lot about climate change in our committee, and we're focused a lot more on the environmental impacts. And we hear a lot about things like sea level rise and, how it will impact, humans and developments and homes, et cetera. But we talk a lot less about the public health impacts of climate change, like increasing temperatures, increasing infectious diseases, and things like that. So we're here to learn more about all those impacts today. So sorry, back to you. Go ahead.
Great. Just want to double check that the screen share is working and you can see the single slide that says climate change and human health.
Yep, looks good.
Okay, great. I'll go ahead and get started. So my name is Diana Felton. I'm an emergency physician and a medical toxicologist. I've been working with the State Department of Health as the state toxicologist for the last 4 years. And we really appreciate you having us today to talk about the human health impacts of climate change. Climate change is a health crisis, and viewing climate change through a health lens can be really powerful because the threat is not just to icebergs or polar bears, or even to our coastlines or oceanfront property or the infrastructure, but it's really to ourselves and our children and our families and our communities. And this is a really powerful motivator for Dr. Kiefer and myself as physicians, but for parents and community members and policymakers. And we really hope that this presentation will help sort of further the understanding that climate change is a health crisis, and that by acting now, we can prevent climate change-induced sickness and injury and death. And I do want to give a warning as we start. This is a dark topic. It's heavy stuff and a little bit doomsday, but I really hope that we can discuss it and that we can be thinking about solutions and mitigation strategies to help prevent some of the health impacts that are coming from climate change. So now I'm going to pass the mic over to my colleague, Dr. Elizabeth Kiefer, to continue with the next sections, and then I'll join back in a little bit for the second half.
Hello, thanks for having us today. I'm Elizabeth Kiefer. I am an internal medicine doctor, and I'm also trained in epidemiology. And several years ago, I completed Yale University's Climate and Health program. And since then, I've been working to educate our medical students, residents, and colleagues about the climate and health crisis. And I'm happy to talk to you today to give you what we as physicians are very concerned about for our patients and our community. So let's get started. We know that climate change through temperature and precipitation changes and ocean acidification causes environmental damage, and that this then causes various health impacts. So how do we know what to expect in Hawaii, specifically climate-wise? We have observations on the warming that has already occurred, and we have a general idea. Air temperature has risen, rain and stream flow have decreased, rain intensity has increased, sea level and sea surface temperatures have increased, the ocean is acidifying, and our trade wind days are expected to decrease. As we talk further, it's really important to understand how climate change will disproportionately affect certain communities and worsen existing inequity. So here is one framework that we like to use to think about how this is possible. So there are climate drivers of health. So let's say increasing air temperatures, for example, and that causes an exposure, such as a heat wave. That then causes a health impact, such as water and salt losses, and that can lead to dehydration, and that causes a health outcome, such as kidney failure. So at each juncture in the pathway, there are elements of vulnerability as represented by these gray arrows. So for example, we have people who are more exposed to the climate driver. So as we'll see, poorer people live in hotter zip codes. Those with underlying health disparities are more sensitive to that exposure. So someone who has diabetes or heart disease is more vulnerable in a heat wave compared to someone without. And then there's vulnerability in the adaptive capacity. So those poor people who live in a hotter zip code, who are more likely to have diabetes, they might be less able to access care, find AC, and therefore more likely to have severe health outcomes. And we'll see that in general, the people who contribute the least to climate change will be the people who suffer the most. This is an overview from the CDC that you may have seen. So climate drivers, as we've said, rising temperatures, extreme weather, rising sea level, and increasing carbon dioxide levels. These all cause an effect on exposure, such as air pollution, water quality, and extreme heat, for example. And these exposures then cause subsequent health outcomes, asthma, cardiovascular disease, malnutrition, for example. So let's begin with one of the most obvious impacts to Hawaii, extreme heat causing heat-related illness, death, and cardiovascular failure. So we know it's getting hotter, we feel it's getting hotter, and we feel this heat, especially in our urban core. So it's worse in the urban core because of the urban heat island effect. And this is not climate change, but it's a man-made problem. And what we have in the city are concrete roads and asphalt that absorb and trap heat all throughout the day, and then release it throughout the day and even into the night. And that's why it's much hotter in the urban core. And this heat island effect actually intensifies during a heat wave. Climate Ready Oahu has created these heat maps for the entire state, and you can look at an afternoon heat index to see where the hotspots are. So here, for an example, from Oahu, according to the community heat maps, the heat islands are actually located in red, so downtown, Kapolei, and the west side. And we see that our poor and most vulnerable patients, according to the census of persons below poverty, we see larger areas of poverty in the urban core and actually in the heat islands. And this is very important for us as physicians to recognize. So when we talk about heat-related illness, we often refer to the heat index, which is heat and humidity that's measured in the shade. And remember, when there's humidity, the body actually has a harder time reducing heat through evaporation, so we feel worse. The wet bulb temperature indicates the expected stress on the human body in direct sunlight, and it includes temperature, humidity, wind speed, and solar radiation. And it's actually a very powerful indicator. And we know that mortality increases when both of these measures increase. And most fatalities are actually preventable. So as physicians, it's important to educate our patients about early recognition. So what do we see in a heat wave on a population scale epidemiologically? So in 2003, there was a massive heat wave in Europe, and France was hit the hardest. Temperatures soared to 104 degrees for 8 consecutive days. These summers in France are usually mild, so there's very little AC. And these elderly patients living by themselves really had never faced such extreme heat before. They didn't know how to react, or they were too mentally or physically impaired by the heat to make the necessary adaptations. And France recorded an excess of 14,800 deaths during this heat wave. So a study of this specific heat wave looked at the average daily temperatures from July to September in France. And so what we have here is an envelope of maximum and minimum temperatures overlaid with a daily excess mortality. And this is calculated based on the expected number of deaths each month, based on the mortality data from 2 years prior to the heat wave. So you can see as the maximum temperatures begin to build at the start of the heat wave, we have deaths also beginning to build, and they reach a peak here. But they actually continue to stay elevated above average, even though the temperatures have fallen. And that is due to the delayed health effects of the heat wave on chronic diseases, as we'll see. So the body responds to heat by sweating and by enlarging blood vessels and bringing heat to the surface to release heat from the skin. But there really comes at a cost. So releasing heat makes the heart work harder, and sweating leads to cooling, but also an increase in fluid and salt losses. And these responses can be very dangerous to people with pre-existing conditions, such as heart disease or kidney disease. And at each stage of the spectrum of heat-related illness, there is a worsening of chronic diseases, which may not manifest for several days, like we saw in the French heat wave. So least severe are heat cramps, heat rash, and heat edema or swelling, and this is due to water and salt losses. Heat fainting, heat syncope, and heat exhaustion are the result of decreased blood flow to the brain. And then most severe would be heat stroke, which is strain on the cardiovascular system, causing reduced blood flow to vital organs or the brain, and this can be fatal. So to treat acute heat-related illnesses, it's important to get the patient to shade, cool them down, remove clothing, and drink fluids. Prevention and early recognition, as we said, are key so that we can prevent progression to heat syncope and stroke. Just a word about fans. Fans can actually cool the body, but at higher outside temperatures, fans can actually blow hot air onto the body and impair heat loss. And it can actually make things worse because this air movement affects the exchange of heat between the body and the environment. And that's important for us to recognize because not everyone has AC. So who is vulnerable in a heat wave? We worry about our kupuna, our children. People who winter in tropical climates may not be as adapted to heat. Those with chronic diseases, sensitive to fluid and salt shifts, poorer people, those people who live in the urban heat island, and people who work outside. And these variations are actually regional. So we actually need a lot more research. I was on a call the other day with a researcher from North Carolina, and they assumed that on their hottest days, it would be kids and the elderly in the emergency room. And until they looked at the data, they were quite surprised. They found that it was actually men ages 18 to 44 who found themselves in the emergency room. And these men were farm workers and factory workers working in hot conditions, then going home to a home without AC, and then back to a hot work environment. And they also found that their ER visits spiked not on the exceptionally hot days of 104 when everyone listened to the heat warnings. Their data showed it was around days 97, 98, 99 degrees where people went about their business, but they still got ill. So we really need local research to understand who is vulnerable and in what type of heat in our own environment here in Hawaii. So this is what I worry about as a mom. This is my youngest son after a lacrosse game where he was head to toe in helmets and padding. And these kids play at 10 a.m. to noon in full sun at Kapiolani Park. And he actually had heat edema early in the spring season on a day with no wind. And he was nauseous, he was irritable, maybe bordering on syncope. And I didn't even recognize it at first as a physician. So we really had to be aware and adapt as parents. So he's wearing this neck cooler and I dump water on his head, but I would not hesitate to pull him from the game or even not have him play on a day where I thought the heat index or the wet bulb was too high. And some states like Arizona have some guidelines to stay out of the sun. And this is even present as policy in some of the schools, depending on the heat index. And that is something that I would love to see explored here in Hawaii. Some cities even have a chief heat officer. But again, we need to know who is vulnerable in our environment. Is it kids? Is it tourists? Is it DOT workers? And at what temperature and what humidity? So there's more work to be done. So let's move on to the health effects from severe weather causing injuries, fatalities, and mental health impacts. We'll focus here on storms and floods since this is relevant, although we are at risk for drought and wildfire as well. So in Hawaii, the current thought and prediction is that the storm intensity will likely increase, so higher category storms, but storm frequency will either decrease or remain unchanged. Again, what do we see on a population scale epidemiologically with these major severe weather events? One of the hardest things to do is actually measure how many people died or were injured in a storm. So when Hurricane Maria made landfall in 2017 with winds of 150 miles an hour, the official death toll for many months was reported to be only 64. People died at home, not in the hospital. And in Puerto Rico, for a death to be officially counted, the medical examiner had to certify it. So there seemed to be many more deaths than 64, but how many? This is a paper from New England Journal that shows some of the issues with storms and health. And I think for us as an island state, the study was really quite illustrative. And they were trying to assess morbidity and mortality. The study was conducted 6 months after the hurricane, and researchers surveyed these barrios or municipalities based on their remoteness. So one of the biggest health considerations was the average time to get to a populated city center where there were health services. And this graphic on the bottom just shows that they selected random barrios of differing remoteness all around the island. And the study made me immediately think of the neighbor islands and our rural remote areas. And the study survey was very simple. They said, who died in your household since the storm, who's missing, and how did people die? And they compared their survey from deaths reported from any cause 1 year prior to the storm. So using their survey and data from the year before, they were able to calculate an estimate of excess mortality. And their estimate was 4,645 deaths. That's 70 times more than the official count of 64 and 4 times more than New York Times estimate of 1,000. So this chart here on the right shows the cause of death with age on the y-axis here and month on the x-axis. So here's the average age of death in Puerto Rico in 2016, a year before. And you can see that the average age of death was about 80, with these blue deaths unrelated to the hurricane kind of scattered about the mean. So after the hurricane here, you can see that we have direct deaths, which are these red squares, indirect deaths, which are the yellow triangles, suicides in purple, and other deaths in gray. There's a very large variation in age scattered about the mean here. And this hurricane really affected everyone. And these direct and indirect deaths actually continue months after the hurricane. Again, this is showing the delayed morbidity and mortality due to chronic disease and also the indirect effects of the hurricane. And this chart up here is just showing that the more remote you are here on the x-axis, the more days, the longer your days without water, cell phone, and electricity. And that makes sense. And this chart shows from the survey that a large percentage of households were unable to get medicine, plug in and use respiration equipment, or even travel to the doctor. And you can easily imagine a scenario where a road is washed out, maybe in Ka'ava on Oahu, or even having to travel 50 miles to a hospital on the Big Island. So this study is actually very illustrative of how devastating these high-intensity hurricanes can be to the health of an island population months and even years after a storm. So what happens on an individual scale? So there are direct causes of deaths from the physical effects of the storm. And these are just listings from the CDC, including burns, crush injuries, drowning, all sorts of trauma from the storm itself. And then there are indirect effects. And these are circumstances leading to other ways to have accidents, deaths, and injuries. And these can be due to cleanup, fleeing the disaster, worsening of chronic conditions like asthma, exposure to hazards, and accidents from a disruption of public utilities and transportation. So for example, in 2021, during Tropical Storm Claudette, there was an 18-car pileup in Alabama on this rain-drenched highway, and people died in car accidents from fleeing the oncoming storm. And then we have things to think about, like all of the usual ways that people get sick, heart attacks, strokes, and other emergencies that need an ambulance, but it can't get to them because the power is out or power lines are down. And then things like people not being able to use their oxygen at home because the power is out. So again, there's a delayed mortality months after the storm from the worsening of these chronic conditions that are usually exacerbated by issues with the environment and infrastructure. And I'll just point out again that a higher percentage of our poor, vulnerable populations living below poverty are actually living in inundation zones. NOAA has a really great interactive tool where you can see the inundation zones for anywhere in the US and adjust the water level. And here I just set it for 4 feet just to give an estimate from a really high intensity storm. And it gives you a pretty stark idea of the reach of the ocean inland. Let's switch gears and talk about vector-borne diseases, which are increasing as a result of increasing temperatures. So these are diseases that result from an infection transmitted to humans and other animals by a blood-feeding species, such as mosquitoes, ticks, and fleas. So mosquito-borne diseases are really most relevant to us in the tropics. And there are 2 big carriers of diseases, and those are the Aedes mosquitoes and the Anopheles mosquitoes. So the Anopheles mosquitoes cause malaria due to the mosquito being infected with the Plasmodium parasite. These mosquitoes are not present in Hawaii. But just to point out that malaria occurs disproportionately in Africa, sickens millions of people, results in hundreds of thousands of deaths each year, mostly in children under the age of 5, and it's a huge global health issue. So these mosquitoes are present in open water, in, for example, like this rice paddy here in the picture. What we do have here in Hawaii are the Aedes mosquitoes, and these species have the potential to transmit dengue, yellow fever, chikungunya, and Zika by carrying these viruses. Aedes aegypti is the most efficient carrier of these diseases, but lives only on the Big Island. Aedes albopicus lives on all islands. And these mosquitoes, unlike Anopheles, they love breeding in containers of standing water. So in Hawaii, these diseases have the appropriate vector, that is, they have the mosquito that carries them, but they are not endemic in Hawaii. However, they are regularly found in our global neighborhood, like Samoa, French Polynesia, and Micronesia, for example, with the exception of yellow fever, which is not endemic in the Asia-Pacific region. So in Hawaii, we're most likely going to encounter local outbreaks, and that's from travel or imported cases. And this is what happened on the Big Island with dengue a few years ago in 2016. So what do I mean by travel or imported? Someone from the Big Island traveled to a destination in our Pacific neighborhood where dengue is endemic. That person contracted dengue, traveled home to the Big Island, and local Aedes aegypti mosquitoes feasted on this person. Human to mosquito transmission of the virus occurred, and those infected mosquitoes then bit and infected several hundred people, creating this cycle and this outbreak on the Big Island. In 2016, this was contained with spraying and mosquito control measures and community education. So dengue, chikungunya, and Zika have similar symptomatologies, and that includes high fever, muscle pain, eye pain. The pain from dengue is so bad, it's actually called bone break fever. And remember, Zika has all of these symptoms, plus it can harm a developing fetus. So here's the rash, the typical rash of dengue. And then some patients go on to develop dengue hemorrhagic fever. This is more rare, and it can be sometimes fatal form of the disease, and there's clotting and bleeding issues. There's no medicine you can take to cure dengue. It's all supportive care in the hospital. And I've seen patients in the ICU for weeks in Peru where dengue is endemic. So if it is severe enough with a large outbreak, these diseases really have the potential to overwhelm the medical system. There is a vaccine, but it's only for children, authorized in 2019 for those kids aged 9 to 16 who had to have had laboratory confirmed previous dengue, but who live in endemic areas. So really not applicable to us. So what happens with climate change in these diseases? In general, increases in temperature and rain favor survival of the larva. They favor a faster life cycle of the mosquito. And with warming temperatures, these mosquitoes can live in places they previously could not survive. So this is a study in the Lancet predicting the effect of climate change on the distribution of dengue. And more red means more of the population is at risk for any one of these diseases. And in particular, this one is dengue. So you can see comparing 1990 in panel A on the top and 2085 predicted in panel B on the bottom, that we're really likely to see more people coming into contact with these diseases. So at home in our state, we actually might see more outbreaks related to travel as more people in the world come into contact with dengue. What happens with climate change and malaria? So in our Pacific neighborhood, malaria is endemic in Papua New Guinea, the Solomon Islands, and Vanuatu. And it's the same story. Increases in temperature allow expansion of malaria into areas it was never previously seen before if the climate is right. Again, we don't have an Anopheles mosquito here in Hawaii, so we don't expect to see malaria anytime soon. However, we have had a history of non-native mosquitoes gaining a foothold in the islands. So this is just something to be aware of. And actually, avian malaria is actually a problem here, but this is carried by a different mosquito. And just a note, if we lived on the mainland, vector-borne diseases that we would also be worried about and that they're talking about a lot with their climate talks would be mostly tick-borne. So those are Lyme disease, Rocky Mountain spotted fever, and tularemia. And again, it's the same story. Ticks are reproducing faster, living longer, and able to live at more northern latitudes because of the warmer weather. Okay, I will hand it over to Diana now for the rest of the health impacts.
Okay, thanks, Elizabeth. Next, we're going to talk about the health impacts of environmental degradation caused by climate change. This environmental degradation is looming, and things like extreme storms and sea level rise and increasing temperatures are going to do irreparable damage to the environment. But the destruction of the environment will cause increased toxic exposures. It will cause forced migration and chronic diseases. And overlaying all of these issues are the mental health impacts of climate change that we'll talk about in this section. So when thinking about increased toxic exposures from climate change, it's important to understand the way that environmental contamination is managed in Hawaii. Environmental contamination is regulated by the Department of Health's Hazard Evaluation and Emergency Response, or HERE office, and the HERE office manages over 1,000 sites of chemical contamination statewide. Contamination is generally the result of historic industrial and agricultural uses and releases, and is often managed in place in a manner that protects human health and the environment, usually by limiting exposure. But what we're worried about is that effects from climate change and rising sea levels will disrupt previously stable chemical contamination, creating new hazards. And the biggest concerns are the movements of contaminants and changing chemical conditions. This map comes from the HERE office's database of contaminated sites called iHERE. Each green dot represents a site known and evaluated by the HERE office to have some kind of chemical contamination. It may be as simple as a commercial site with a small amount of lead contamination in the soil from deteriorated lead-based paint, or as complex as a large industrial contaminant release or an oil spill. And note the high density around military installations and industrial activities. So this is a close-up of the same map, but of a highly industrial area of Oahu at the entrance to Pearl Harbor and airport and Honolulu Harbor. And again, each green dot represents a site with chemical contamination. So what we're worried about is what's going to happen to all these contaminated sites when they're affected by climate change, either submersion from the sea rising, groundwater inundation, or increased flooding from more intense storms and coastal erosion. So in order to better quantify and understand the magnitude of this problem, we took some different GIS maps and we took and overlaid them. So we took the Hawaii State Sea Level Rise Viewer of predicted 3.2 feet of sea level rise, and also flood maps from NOAA that predict what used to be called a 100-year flood, but is now called a 1% per year chance of flood. And we overlaid those on top of our chemical contamination maps. And so this is those maps of Honolulu Harbor. On the left side, the yellow locations are properties with some type of chemical contamination that's managed in place. And the blue in that map represents the areas that will be flooded by 3.2 feet of sea level rise. So you can see that many of the contaminated areas will have water inundation, possibly disrupting or moving the stable contamination and creating new hazards, both to people and the aquatic environment. And the map on the right shows the same location, but with the purple areas representing what an extreme flood would do with higher sea level. You can see the whole area of the harbor will flood, moving around chemical contamination, mixing chemicals, and creating more opportunities for exposure. So when we expanded this mapping to the entire state, we found more than 800 sites statewide that have chemical contamination and are at risk from climate change impacts from increased flooding and sea level rise. Then environmental degradation is also a major driver for forced migration related to climate change. According to the UN's Intergovernmental Panel on Climate Change report that was published in 2022, 143 million people are likely to be uprooted by rising seas, drought, searing temperatures, and other climate catastrophes within the next 30 years. And this is really a conservative estimate, with other groups modeling the number as much higher. And in our particular neighborhood, the Pacific Islands, which contribute less than 1/10 of the world's greenhouse gases, but they suffer some of the worst consequences of sea level rise. So the picture on the left is in the Marshall Islands, where in 2019, so it's now 3 years ago, the country declared a national climate crisis. And they're really trying to decide whether to relocate their nation to limited islands and abandon the ones that are going underwater. The picture on the right is a Micronesian family in a shelter in Kalihi that was profiled in an article in the Huffington Post a few years ago. And what they talked about in their article, and is a repeating story, is that as these areas in the Pacific are losing habitable land from flooding, but they're also having reduced crop yields, reduced access to fresh water, and it's compounding existing economic problems, pushing people to leave their homes, leave their islands, and move. Due to Hawaii's position in the Pacific, it's certain that a significant portion of these displaced persons from climate change, or sometimes called climate refugees or climate migrants, will end up in Hawaii. And that forced migration will have massive impacts on cultural traditions, on communities, on resources, and on health equity. Another problem is that as the environment degrades, people's access to traditional food sources change. And that has significant downstream impacts on people's health. In 2010, the US-affiliated Pacific Islands declared a state of emergency due to non-communicable chronic diseases like diabetes and heart disease. One of the contributors to that was thought to be the destruction of coral reefs from bleaching events that in part led to a loss of cultural practices like fishing off the reef, changing people's diets and leading a lot of people to eating more canned and processed foods, as well as imported salty fatty foods, which can lead to obesity, diabetes, and heart disease. As an example, the first hemodialysis center was opened in Fiji in 2008. And despite the costs associated with hemodialysis, demand for treatment has increased so much that now they have 6 standalone dialysis centers in Fiji in just a few short years. There's researchers at the University of Hawaii, including Dr. Bob Richmond, Dr. Catherine Perkle, and Dr. Lorinda Riley, who have been doing excellent work reinforcing the links between coral reef health, ocean health, and human health. And a thriving ocean environment continues to be essential to human health in Hawaii. Okay, next topic. And this is really a big one that spans the entire scope of this talk. And this is climate change and its mental health impacts. The bottom line here is that climate change has and will make existing mental health conditions worse and will create a lot of new mental health conditions. I've broken this up into different categories to help us understand all the different aspects of this very complicated and really under-researched issue. So we have the direct effects of climate change, impact, and mental health impacts of living through a disaster. We have subdirect effects, which are impacts from climate change related events, but are not as obvious as the direct effect. And then indirect effects, which are impacts from watching climate change and climate change events happen from afar. So the direct effects are fairly easy to understand. The experience of living through a disaster, a severe weather event, a wildfire, a hurricane, where you fear for your life or your property or your way of life was directly threatened. You may have witnessed people you love die or your home destroyed. These kinds of events can have massive impacts on mental health, both population and individually. It can cause trauma and shock, PTSD, strains on social relationships, depression, anxiety, substance abuse, violence, loss of autonomy, and feelings of hopelessness and fear and fatalism. In a report published by the American Public Health Association in 2021, 54% of adults and 45% of children experience depression after a natural disaster. And it used to be thought that most of these impacts were temporary and would improve with time. There's growing evidence that, in fact, the residual mental health impacts from living through a disaster may last for a very long time or even be permanent. And this is particularly true in a model of repeated exposure or repeated disasters, as we're seeing in some regions as a result of climate change. So a lot of information about this phenomenon comes from studies done after Hurricane Katrina. In one study, a group interviewed 815 residents of New Orleans who lived in the areas affected by Katrina. They didn't even get to this survey until 5 to 8 months after the storm. And then they did follow-ups again a year later. And they found that suicide attempts and suicidal ideation more than doubled after Hurricane Katrina. 1 in 6 residents had PTSD. And most significantly, they did not see significant decreases or a return to the historical baseline on their follow-up that was almost 2 years after the storm. So it's really evidence that it doesn't get better as in a short time period as recovery from an event like this. There's some other associated mental health effects, including increased substance use and risky behavior, mental health effects from a declining physical health, loss of social support and employment, and population migration and community changes that impact people's mental health and resiliency to mental health and stress. So these are all expected with climate change. But one of the most compelling of these other aspects that are expected from climate change is the association of increased aggression and violence with heat. For a long time, there's been a correlation with increased violence in the summertime, with a lot of competing explanations for it. But one group in 2011 did a really interesting study to further look at this. And they compared data from 1950 to 2008 from the FBI Uniform Crime Reports. And they had 2 groups. They looked at violent crime, so rates of homicide and assault per 100,000 people. And they looked at nonviolent crime, so rates of burglary and motor vehicle theft for 100,000 people. And then they overlaid the average annual temperature data from NOAA for the same year. And what they found was that hotter years had significantly higher rates of violent crime, but not nonviolent crime. So the violent crime rates went up in the hot years, but the nonviolent crime rates didn't. And that relationship persisted even after controlling for numerous alternative explanations like incarceration rates and population changes. And the researchers estimated that based on these findings, with every 1 degree Celsius increase in average temperature, which is fairly conservative estimate of climate change in the coming decade, it will likely yield a 6% increase in violent crime rates, or as many as 25,000 more serious and deadly assaults per year in the United States alone. It's really concerning about this relationship between heat and violence. Similarly, there have been associations between heat and other mental health impacts. One study in Nature Medicine in 2022 looked at data on mortality and temperature over a 38-year span, and they looked at different types of injury-related deaths. And what they found that there was an increase in suicide deaths with periods of high temperature. Similarly, a study of children in 2019 found that kids were more likely to visit the emergency room for mental health problems like anxiety and suicidal thoughts on days with higher levels of air pollution. And children living in low-income communities with less access to healthcare were more severely affected. There's also been links shown between adverse mental health and air pollution during pregnancy, linking increased rates of postpartum depression to increased exposure to particulate matter and air pollution during pregnancy. So the causality and the mechanisms of all these correlations are not completely clear, but the associations are definitely there. And it really requires some more research and more thinking about possible correlations and preventative measures to help mitigate these mental health impacts. And then there's the indirect effects, or this idea of mental health impacts people have from watching other people go through climate-related effects from afar. A component of this is called eco-grief. And this can affect anyone at any time, and it can be from hearing about climate change or disasters in the news, from seeing it on social media, or witnessing the experience of family and friends. I know I feel these effects really frequently. I have family in very high-risk zones in Northern California for fire, and I spend basically all of my late summer and fall with an increased level of baseline anxiety, worrying about my parents' well-being and their safety. Frequently checking the fire maps and the news and just constantly on alert of how they are. And this can happen to anyone with any family or friends or people or places that they care about that are threatened by a climate-related impact. But even on a milder scale, I feel anxious or depressed when I read news about climate change or hurricanes in Florida and the destruction and problems that are happening. And so this is really impactful on people's sort of day-to-day mental health, and it's especially impactful on children. And children are really disproportionately affected because they have cognitive and physiologic immaturity. There's also a component of the younger generations and kids really feeling let down, that no one's done anything about climate change, that we're leaving this mess to them. And that's been really shown to be really impactful on youth mental health as well. So in addition, related to the environmental degradation is the issue of water quality. And this can severely impact human health via microorganisms that can cause disease. So when thinking about water quality hazards, it's important to recognize that sea level rise is more than just the level of the sea getting higher. These images are from some really great work done by a team at UH led by scientist Shelley Habel. And they've demonstrated how sea level rise will include not only direct marine flooding, meaning the sea getting higher, but that it also causes backflow into storm drains and other drainage systems and will cause the level of the groundwater to rise. So that leads to inundation and flooding of any low-lying structures that are even a ways back from the coast. And this is especially important when thinking about cesspools. And you can see from this picture on the right here of a parking garage flooded during a king tide. And that's really from groundwater inundation, the groundwater getting higher from the higher water levels. And so when thinking about cesspools, the idea of groundwater inundation, sea level rise and flooding from severe storms, we're going to see these cesspools flood long before the actual surface of the sea rises higher. So this image on the left from the Surfrider Foundation shows how flooded cesspools will release sewage and pathogens into the environment, potentially compromising our drinking water sources and also causing diarrheal diseases, skin conditions, and other health impacts from anyone who might come in contact with these pathogens. There's also several waterborne infectious diseases that are expected to increase with climate change. One of those in Hawaii is leptospirosis. People contract lepto when they are exposed to bacteria in fresh water. It's usually a flu-like illness, but if not treated, it can have significant liver and kidney effects. And more flooding equals more risk. And this association has already been demonstrated in places with really distinct rainy seasons, like in Thailand, where they found, rainy season, more flooding, more rain, more leptospirosis cases. And another waterborne skin infection I really worry about is Vibrio vulnificus. Vibrio vulnificus lives in salts and brackish water and is more prevalent in warmer waters. People become infected by it when they have wounds or open areas of skin that come in contact with this bacteria in the ocean. And these infections are horrible. They cause a necrotizing or a flesh-eating infection, and they have very high rates of mortality, up to 30% mortality rate if you get infected with this bacteria. Currently in Hawaii, we only have about 20 to 40 cases per year, but warmer sea temperatures are expected to increase the amount of Vibrio present in Hawaii's waters and increase the number of infections. Because of the severity of these infections, even a very small increase in cases will have a huge impact on the individual, but also on healthcare resources such as ICU capacity, operating room availability, etc. And this is potentially a really important impact on sustainable fisher communities where people spend a lot of time in the water. And the Alawai Canal in Waikiki has high concentrations of Vibrio vulnificus and is also prone to flooding. A recent 2022 study by researchers at the University of Hawaii modeled a 2 to 3-fold increase in the concentration of Vibrio by the year 2100, and then increased rainfall and storms transporting that bacteria into the near coastal areas of Waikiki, potentially exposing many more people to this devastating infection. So in addition to impacting our water quality, climate change will and is now impacting our water and food, our drinking water and food supply. And this can lead to malnutrition, diarrhea, and food shortages. This is a huge topic and one that really kind of deserves its own hour, but we're going to cover the basics really quickly. Drinking water and food supply can be reduced by climate change in many ways. You can have uncontrolled runoff impacting wastewater treatment, which can lead to diarrheal illnesses, with kids in the Kapuna being potentially especially vulnerable. You can have contaminated drinking water and food crops, which can lead to malnutrition, and significantly reduced importing capabilities leading to food insecurity. In addition, earlier today was learning about ocean acidification and how that might impact fish populations and again, increase food security by decreasing available fish. And that's a global problem. So, imagine, and this idea of significantly reduced importing capabilities is really important here in Hawaii. So imagine, any of our islands, if the main harbor to the island or the airport were damaged in a big hurricane, how will we import food? This is really an important issue for Hawaii and very concerning looking to the future of increased or worsening storms. So lastly, we're on to the health effects due to air pollution and allergens. And that's specifically important for affecting people with chronic respiratory and cardiovascular conditions. So one of the concerning expected environmental changes from climate change in Hawaii is a decrease in trade wind days. This graph is from a report from SOEST in 2014 that plotted out the frequency of days in Hawaii with trade winds, and you can see a steady decrease since the 1970s. And really, this is expected to continue with all the climate change models. So what does this mean for our air quality? Well, with the exception of the Big Island during volcanic eruptions, Hawaii really has incredibly good air quality. But especially in urban areas, that is partly the result of the frequent trade winds disseminating our vehicle exhaust and our industrial emissions. So if air quality declines, we see a decrease in trade wind days, air quality declines, we'll likely see an increase in resulting respiratory and cardiovascular illnesses. And this is particularly important on the Big Island, where poor air quality is more frequently observed due to volcanic emissions and VOG. This is a picture from the USGS from the recent Mauna Loa eruption, and trade wind patterns and some of the weather patterns were significantly responsible for us not having significant air quality impacts from this most recent eruption, despite large amounts of toxic emissions coming from the volcano. So losing trade winds could really increase the number of VOG days when the volcano is erupting. And that's a big concern for the Big Island, but also for other parts of the state, as we can see this VOG spread during those periods. So pollution, whether from wildfire or from human, anthropomorphic causes or from volcanoes, is often driven by fine particulate matter, or PM 2.5. And when you have increased PM 2.5, you see really increased effects among those with chronic heart and lung disease. And in addition to problems with eye and lung and throat irritation, effects of heart disease worsened and premature death, poor air quality has also been associated with poor birth outcomes and a whole slew of other health problems. So air quality and maintaining good air quality is really important for the chronic health of our population. And we've also seen pollen season lengthening throughout North America due to an increase in carbon dioxide causing the growth of weeds and grasses. In Hawaii, we have a lot of flowering and pollen year round. We've not really seen any hard data about increases in allergens in Hawaii, but there has been a lot of anecdotal reports of people having worsening allergies for a longer period of time. But this is definitely an area where we need more research to find out if we're in fact having more pollen, more allergies in Hawaii. But another air quality concern affected by storms and flooding is mold. And heavy rainfall and flooding cause dampness and indoor mold and fungal growth. And that can be associated with nasal and throat symptoms, coughing, wheezing, asthma exacerbation, and many other problems. And it's also important to remember that flood cleanup activities, particularly around mold, can be quite dangerous, exposing people to toxic chemicals and mold. And this picture shows a flood and mold damage at the University of Hawaii Library in 2004. And you really have, less than 3 days to clean up a flood before mold sets in and can really be harmful. So that is a very quick overall review of expected impacts of climate change on human health in Hawaii. You can see in general, it's a really wide range of health effects. And the next question, of course, is, well, what can we do about it? How can we promote health and fight climate change? And for us, it's really all about framing climate change as a public health problem with solutions that benefit health. So, there's many climate change mitigation measures that will take time to actually decrease greenhouse gas emissions. But some of these have health co-benefits that may be seen much more immediately. So converting from fossil fuels to renewable energy will take decades to reduce carbon dioxide in the atmosphere, but the reduction in local air pollution can be much more immediate. Using a bike or taking the bus or walking puts less fossil fuels in the atmosphere, but is also healthier for everyone's lungs and bodies. Eating less meat can decrease methane, but it can also prevent heart attacks. Similarly, offering reproductive services decreases the amount of human consumers on the planet, but it also decreases unintended pregnancies. So even if climate change were not occurring, these measures represent critical public health interventions in their own right. And it's just really powerful that we could think about combining climate mitigation efforts and immediate health co-benefits. So what can we do about climate change individually? We've given you so much information to be alarmed about, but how can we start improving the problem? And oftentimes individual action is seen as not enough or just a drop in the bucket. But the truth is nothing will change without individual actions to reduce our carbon footprint. Individual actions are necessary, but they're also not sufficient. And larger scale policy change is needed to improve our resiliency and our ability to adapt to climate change and to prevent the associated morbidity and mortality that we've described. So this slide just shows some general ideas of what could be done from policy side of things to improve some of these health impacts and mitigate some of these hazards. Excuse me, enhancing warning systems for storms and hazards, development of a program for cooling centers and heat warning percenters, a heat officer to coordinate, addressing energy costs so people can use AC as much as they need, increasing support for mental health services and primary care, as well as health services and agencies responding to these issues, supporting research and understanding Hawaii's specific risks to prioritize action. And we really think it's important that climate change planning has a health focus. And we hope that this presentation has helped highlight the need to add a health focus to climate change planning on all levels. We really appreciate and thank you for listening, and we're happy to take any questions. And our emails are here on the slide, and please feel free to reach out. And both Elizabeth and I are here to answer any questions from the audience.
Thank you so much. That was that's a lot to process, but a lot of really good and somewhat scary information, but important to understand better, I think. Can you also share your presentation so we can make sure to share that out to members? Okay, there we go, stop screen share. I have a number of questions, but I want to go ahead and open it up to other members first. So I guess use the hand raise like reaction if you have a question. Okay, Rep Ward, you're up first. Go ahead.
Thank you, Chair. Thank you for those excellent slides, information, and thank you for the high dose of legislative eco-grief. I never heard of that term, but I can see it's going to be popularized for your presentation. I find sometimes when you say dissociation, it implies correlation, so we've got to watch the data. We got to keep the science. And for my question, I have a slight cultural side note to increase your credibility. When you had the slide with kapuna, it's kupuna, K-U, not K-A. You might want to change the spelling in your slide. Otherwise, excellent slides. Fantastic. The question I have is, do you have data that has created not data, but do you have the actual either reso or bill or whatever creates a health officer? I want to see what the health officers do. And if you've got something that describes them in some other capacity in other states, that would be very helpful. My question is, what does a health officer do?
Did you mean,
and if you've got the data that shows that, you could send it to us.
Sure. Hi, Representative Ward. Did you mean heat officer?
Oh, sorry, heat health officer. See, I'm getting my eco-grief already.
Yeah.
Yes, the heat officer, exactly. That's the new position that I'd never heard of.
Yes, there's I actually just learned about this myself. And so there are some cities like Phoenix, for example, and Miami that have a chief heat officer. And it seems that these positions have been created in the past year or two. And my understanding is that they're involved in coordinating public warnings, setting up different cooling centers, things like that, and coordinating with the public based on a heat index or a wet bulb globe temperature that they monitor. But I can get you more information and more specifics about that from these particular cities.
So it's in the counties, it's not at the state level, it's at the municipal level then?
The ones that I were at the city level, yes, but I can get that information to you.
Okay, thank you very much. Thank you, Chair.
Thanks. Anyone else have a question they want to jump in with? Rep Kahaloa, did you have a question or are you just getting your video on? Okay, I'll go ahead with a few of mine then. And then anyone who has a question, just use the hand raise function or wave your hands around, turn your video on and wave your hands around. I guess first question on the question of extreme heat or, that those kind of events where you have heat plus humidity that makes it hard for people to cool down. What have we seen already occurring over the past, say, decade or so in terms of heat increases in Hawaii? Has there been a noticeable, I think from my personal anecdotal evidence, I feel like there has, but I'm just curious if the data that you guys collect back it up, that there's, more days that are humid, more days that are hot, more days where you have both, and what's kind of the degree of increase of those that we've experienced already?
Yeah, that's a great question. I'm not sure there's been a lot of direct look at this. So one of the things we're actually trying to set up is to coordinate looking at the temperatures and heat related visits to emergency rooms across the state. So we, at the Department of Health, we've developed we have a fairly new program. It's called syndromic surveillance, which allows you to really specify exactly what kinds of health problems you want to look at it and look in real time. It's kind of designed for disease outbreaks, but we've been expanding it to some environmental health issues, and we're setting up the program so this summer actually we can look throughout all the emergency room visits at all the hospitals across the state except for Tripler and look at heat related visits, and then we can go back and compare the heat index that day, the temperatures that day, and sort of compare. But as far as pure temperature days, I have not seen that data. I think NOAA definitely has it. but we need to kind of look at it in a health frame a little bit more closely going forward.
Yeah, it would be interesting, especially to combine it. I mean, I think have seen data that shows that to a small degree, our average temperatures have increased, but to combine that with kind of, I mean, as we all know, the days where there's no breeze and there's 78% humidity feels a lot hotter. So kind of on that same note, and again, not seeing any hands raised, I'll just go ahead and proceed with my questions. But if anyone has a question, just raise your hand. Do you think, because I know nationally at least, there's a lot more focus on policies to address like extreme cold temperatures that maybe just has, grown out of historical things that is, less taking into account the kind of future that we're facing that has more extreme heat related events, even, whether that's including like shelters, like air conditioned shelters, or even things like looking at something like high energy costs. Like I know there's policies sometimes on the mainland, if there's an extreme cold event, like the utility can't shut down anyone's electricity, for example. Like I wonder if any extremely warm places have similar policies that you're aware of, like if it's extremely hot that you cannot, turn off somebody's power, their ability to use air conditioning. So I guess on that note, I mean, do you feel like I guess it seems like a newer development, like examples to address these extreme heat events. And I don't know that we've spent much time thinking about it in Hawaii. I especially think about our shelters frequently are public schools. And then we have this whole ongoing conversation about not having enough air conditioning in public schools as it is, which is a whole another climate related issue, I think also. So I guess just thoughts on that.
Yeah, I think it's really, you make great points. Arizona has been kind of leading the pack on this, and they've really just gotten their cooling centers program up and going in the last couple of years. And they have finally have some evaluation data of how that goes. And I believe they do have some of that kind of utility legislation about it. But some of the states in the Pacific Northwest and California are now kind of getting on board with that as well after the big heat dome episode they had. I think it was last year, or the summer before. So Oregon is starting to develop cooling center programs, and as well as legislation to related to the electricity and stuff. So there are some models to follow, but I agree with you. I personally hadn't thought, don't think a lot about heat here, because in a lot of ways we feel like we're used to it, doesn't get those super hot temperatures, but particularly with the decrease in the wind, in the trade wind days, and just the average temperatures going up, this is in our future. And I think we will, be needing to have some of these problems worked out, and the more we can plan ahead.
Right. Even with like energy efficiency measures are focused on weatherization for cold weather. And not also thinking like as air conditioning, I think is just thought of less as a sort of basic need or right, or health measure compared to heating. So just a different way of framing things, I guess. Again, any questions from committee members? Okay, still not seeing any. I'll continue forward. Oh, no, Rep Ward, go ahead, jump in. You're on mute.
Sorry, I have another question. Questioning the data. Having lived in the jungles of Borneo for 2 years with Anopheles mosquitoes all over the place, when you correlate the malaria deaths with heat rather than the banning of DDT, I think you're stepping a little bit outside of the scientific. The millions of people that are dying every year in Africa because they don't have DDT is not related to heat. Even though your heat hypothesis makes sense, that chemical banning is what basically malaria was under control. And I've lived in Malawi, Africa. So anyways, just kind of note that, because you want to be credible when you do these things. And some of that for some of us have been done. Thank you.
Yeah.
Just a comment.
I can address that. Thank you for that comment. Actually, there is, so I apologize if that was misrepresented. A lot of the data actually shows that malaria is being found in areas where it previously wasn't found. So more people are coming into contact with malaria as temperatures are warming. So there's a slide that I didn't show here in the presentation that shows Ethiopia, and they compare 1980 to 2014 or wherever it was, and they overlay different types of malaria and where they're found geographically. And what they see is with warming temperatures, malaria cases have now gone up into the highlands and the plateaus where it was previously cooler and not found. So the correlation was more cases and geographic expansion into areas that hadn't previously seen those diseases. And that's what we're seeing with tick-borne diseases on the end as well, where ticks are able to survive in Maine, Canada, higher latitudes where you had not seen cases of Lyme disease, those kinds of things.
However, Dr. Felton, you have to have the intervening variable of the demise of DDT. That's my point. When you take that out, of course it's going to rise. And in saying that it's heat rather than the lack of the antidote, DDT. Anyways, that's just an aside.
I think my
Okay.
takeaway was more that the natural area for these species to survive will spread further north to more populated parts of the globe with increasing temperatures, whether it's ticks or mosquitoes. I guess on that note, well, I guess I'll backtrack a little, just kind of going over all with the health impacts, whether it's heat related or this increase in vector-borne disease, et cetera, or some of the waterborne diseases you were talking about. I guess you would then anticipate, I mean, if our medical facilities were overwhelmed, then you have like a kind of compounded, if we don't think about how to deal with this stuff or expanding services to be able to accommodate it, then you might have like another effect where if you don't have medical facilities for people who have, you know, what we consider part of, you know, what's in our current expected kind of people coming in with regular issues. If you don't have capacity to treat them, then you might see excess deaths additionally related to just not having enough capacity.
Yep. And that's really, you know, that's one of many lessons learned from COVID and the surges over multiple, you know, days, weeks, months that we found was, you know, and this is data has been seen globally as well as throughout the United States and Hawaii is in local areas. You know, if you have limited capacity, ICU capacity, ER capacity, operating room capacity, and you overwhelm it, then, you know, people can't get the same treatment for the usual things as well, for trauma, for strokes, for heart attacks. So that's definitely a concern. And, you know, that example of the Vibrio vulnificus infections is a good one, I think, because those people with severe Vibrio vulnificus skin infections often require 4, 5, 10 surgeries in a short period of time. And, you know, in many of our smaller hospitals, we only have a few operating rooms per hospital. So you take that away, you have decreased ability to do emergency sections, you have decreased ability to do traumas and appendectomies and other things. And then you think about, you know, often these people are in the hospital for a month at a time, in the ICU for a month at a time. And that's, you know, taking away beds for severe flus or strokes or whatever it might be. So the impact on, you know, what in Hawaii, we have somewhat limited medical services. It really is a concern. So I think, and when you add up all these different possibilities of cases of dengue or severe lepto needing hemodialysis or Vibrio, it's really starts to paint a picture where we have more chronic disease coming and more severe disease coming.
So I guess, what do you think are I mean, I think some other things that really stood out to me, I mean, just this idea of increased heat leading to increased aggression and violence. And that's kind of frightening because, you know, I don't know that there's a lot that we can do to prevent the increases in temperature that are, you know, we're going to experience, even if we, you know, take every step and reduce all greenhouse gas emissions by 2030, like it's still happening. So, yeah, I guess it's thinking more about how to make sure people have comfortable environments. But yeah, I don't know that I have a question there. That just really stood out to me. And then in addition, I guess my last question, unless anyone else has a question. Okay, I'll save it. Rep Cochran, go ahead.
Thank you. And so I was just being a representative of Lahaina, which in Hawaiian means merciless sun. So here, yes, we praise the rain we've just had, but the sun is merciless. And for our schools, Chair, you mentioned that, the public schools and lack of AC, and that is an issue here too. So are there studies or any type of information in reference to the heat and the learning abilities or, lack of focus by our children in the classroom because they're just overheated? So I think that's my question. So I can hopefully seek money or get, urge our DOE and LEDGE to fund schools here to keep our keiki cooler in the merciless sun environment that we have here in particularly Lahaina.
Thanks. And Rep Poi Poi has a question as well. So go ahead.
In terms of the heat correlated with learning, it certainly makes sense to me just sort of logically. I don't know of any studies offhand, but we can look and certainly send you any data that we find.
Okay, great. That'd be wonderful. Thank you.
Thank you. And Rep Poi Poi, if you want to go ahead.
Thank you. Thanks for the presentation and for introducing me to the term eco-grief. I'm like, oh, that's what I have. Eco-grief. I had a couple questions. One was just about one of the slides, the one about contamination, and you showed all the yellow dots. I was just curious if those dots also represented cesspools or not.
No, cesspools are not included in that map.
Okay. I've seen a cesspool map before too.
It's also concerning.
Yeah. And then my other question was, if I know all of these things presented, affects all people in some ways. If there was anything particular that we should pay attention to as possibly affecting our Native Hawaiian population more than other populations?
Yeah, that's a great question. I think some of the impacts that are, on more traditional cultural practices, on sustainable fisher communities, may be more associated with Native Hawaiian populations. Certainly, there are higher rates of respiratory diseases, of diabetes, of obesity in Native Hawaiian populations. And, a lot of those things we talked about today, though, people with those chronic diseases are more susceptible. So that may be a disproportionate effect on Native Hawaiian populations. But I think also some of the, environmental degradation, people's relationship to the land, and how that may impact their culture, their cultural practices. Some of the fishing practices is described in, with the destruction of the coral reef and traditional fishing practices in some of the other Pacific Islands. I think that's maybe more disproportionate possibly in the Native Hawaiian population. So I think there's a lot of things that may be disproportionately affecting that group.
Okay. I just thought of one more question.
Go ahead.
I was just curious if you work with or confer with Mamalu Poi Poi, the mosquito monitoring group, for your mosquito data.
Yeah, I have not directly. I think our vector control branch at the Department of Health does. But I have not directly, but it's, and the DLNR does a lot of mosquito monitoring as well, but I think it's really important, and early identification of changing geographic distribution of those mosquitoes is going to be really important for cutting off some of those vector-borne diseases before they really spread. So yeah, I think that's such great information coming out of those groups, definitely.
I have no relation to that group, just FYI. Just the same word. Thank you.
Yeah, I also just wanted to make one comment about the eco-grief. Sometimes when I give talks on this subject or talk about this, I ask the audience to gauge their anxiety level when we start, just like on a 1 to 10, like what's your current anxiety level, and then have people do it again just to themselves at the end. And even for myself, I talk about this all the time. I work on this all the time. And even just talking about it makes my anxiety go up. So those indirect mental health impacts of this stuff are really powerful.
I guess kind of following up on Rep Poi Poi's question a little bit, and then I have another question. What do you think, is there a need to collect more data in terms of climate vulnerability in the state, and which groups, which areas are most impacted?
Yes, I would say for sure doing some sort of like the heat study that Dr. Felton was talking about that's going on this summer. And just because we don't really know, you kind of think, oh yes, the children and our elderly patients are more vulnerable, but I think until you actually look at the data, you don't really know. And also, what is it, the extreme heat days, it's the low wind days. We kind of all have assumptions about what we feel is, a worse heat day, but until you look at the data, we don't know those correlations. So
right. And then are there demographic differences, or is it more geographical?
Correct. Yeah.
So I guess the slide that you had that sort of had the mitigation measures and then some had like a health co-benefit. To me, that was really interesting, especially thinking about, like our transition of the transportation sector, because cars are such a source of pollution. And even with good air quality in Hawaii, if you live near a busy road, you're still experiencing that regularly. So there's not, even if with good air quality at the locations our air quality is monitored, it doesn't mean you're getting away from exhaust when a car drives right by you. I guess which of those do you think are the most important ones? I think you had, I just remember on the slide there, you had the health co-benefit listed, but then you had a couple that had like up arrows on the other side. It was air pollution, I think, the transportation piece, and then maybe something about like urban trees.
Yeah, the urban tree one was just the example that, for example, Dr. Camilo Mora and his initiative to plant a million trees on Oahu, for example. So that will reduce greenhouse gases, but then you talk about the health co-benefits of having more forests, for psychological benefits, for exercising, things like that. So that was the point of that slide. But
do you find definite correlations of people? Well, I guess even for myself, it was so cold the past few days, and I walked from my office to go get lunch, and it was like chilly outside. I was carrying an umbrella, and I thought, well, this is like a completely different experience than, 95% of the time where you're just walking to get lunch and you come back all sweaty. So I don't love that. So I guess, do you kind of see in the data differences, like with the temperatures or the lack of shade, and that people actually exercise less?
I would have to get you the specific data for that. I don't know if I'm sure there's regional variation and there's a lot of different factors for that, but I'd have to look to show you the actual correlation.
We've done some interesting work on that in the state of Rhode Island, on treed neighborhoods, untreed neighborhoods, correlation with socioeconomic status and trees, and then activities and health also. So we can dig up some of that information and pass it on as well.
Okay, Rep Bellotti, go ahead. Chair Bellotti, rather.
Thanks, Chair Lowen. Thank you, doctors, for participating in this info briefing. I guess this question is for Dr. Felton with the Department of Health. So returning back to this subject area, I'm curious, to what degree is the Department of Health engaged with the CDC in their Climate Ready States and Cities initiative?
That's a great question. So the main funding and initiatives from CDC around this is, as you say, the BRACE grant is the main grant. CDC's most recent funding of that was last year, I think, and they funded 16 states and cities. And all of the states and cities that were funded had previous BRACE grantees. So there hasn't really been a way to break into that world if you don't already have the infrastructure. So we're working on some things on this end. We were fortunately granted a climate change and health position within the Department of Health by the legislature last year, which we're very excited about. And having even just this one person to start to build a climate and health program within the Department of Health will really help, because it will really help coordinate all the disparate groups within the Department of Health that are doing little bits. You know, the HERE office is working on that, the environmental contamination, the Clean Air branch is working on reduction in greenhouse gas initiatives. The vector, the disease outbreak control division is working on the vector disease stuff, the vector control branch. So there's all these disparate things, and bringing it together from a climate change focus with a climate and health coordinator is going to be really important. And then the hope is that the next time there's BRACE funding, we will have a much better position from which to apply for the federal funding and try to build out a program. In addition, we've been working through some national groups to really push the idea of what's called a baby brace program. So we've been pushing CDC to, we're expecting that the CDC is going to get more funding for climate and health. And we want them to create programs that are sort of smaller than the original brace and allow a state health department to build their program from very little, as opposed to already having this well-established climate and health program and just adding to it. So we've gotten some pretty good traction and some interest from CDC on that. And there's actually a group at the University of Massachusetts that's doing a full review of BRACE and how to make it better for the states and more applicable, use their framework to make it more applicable. And we're going to participate in that evaluation and restructuring. So we think we'll be able to add more of a voice from Hawaii and from smaller states that don't have as much of a program already established. So we're making some progress, and this climate and health coordinator, who we're hoping to get a body in that role very soon, is really, I think, going to be able to make some advancements, really start to capitalize on a lot of this federal funding and start to build out this health focus on climate change.
Chair, if I can follow up on just that note.
Yes, please.
So I heard you answer it partially, but where are you in the process of being able to hire somebody?
We are still, and I apologize, the hiring process is still a giant black box for me. I believe the position I'm going to get the terminology wrong, but I believe it has been established, but it's not ready to be posted yet. But I can get back to you on exactly where we are in the different process.
Thank you. I think that's a really critical first step, like you said, and I love it that you call the other programs baby brace programs. I think we should definitely get ourselves ready to be prepared for a next round of funding potentially. And the partnerships with the mainland, with CDC are going to be critical. Thank you, Chair. Thank you.
Thank you. On that note, are you aware if there's federal funding available for any programs through the bipartisan infrastructure law or the IRA that would address some of the needed mitigation measures? I guess I'm not as aware of what would apply to specifically these issues.
It's a really good question. My understanding of a lot of that money has been very specifically distributed out to individual groups. So there's tons of money for safe drinking water groups and different activities. And I'm hoping a lot of people will choose to use it on some of these mitigation. But as far as climate in general, I think there is some in the IRA, but I don't think it's been delineated enough to know exactly where it's going to go and how it's going to use either through EPA or CDC. But I think that's part of where they're hoping more BRACE funding is going to come from. But I don't think it's been clearly stated yet. But I can certainly find out more for you on that.
Great, thanks. I guess next Rep. Ward, followed by Rep. Poi Poi.
Thank you, Chair. I promise this is my last question. It's the projected versus the actual. We have in the sea level rise numbers that you gave, we have actual measuring devices in our ocean in Waikiki or whatever other places, or is it the modeling that generally the climate change sea level rise? We have actual gauges that say, hey, last year it was this, now it's this year, and we can go back 5 or 10 years, etc. The empirical versus the projected.
There's both. So
no question.
Oh, good.
I was going to say, no, I'll let you be a question, not necessarily specifically for these guys, but I can definitely point you to who talks about like the sea level rise data.
I just need the numbers. I'm a metrics guy, and I need to see what it was last year, the year before, etc. So we know that as you predict 3 feet something, and we actually have the measurement gauges. That's my point. And how do I get access to that data?
Yeah, so on the NOAA website, you can actually see sea levels every 6 minutes, going back years. That's a little
Terrific.
to see every 6 minutes, but they have more broader stuff as well. So the NOAA website is a good place to look historically. The things we were quoting in sea level rise is projected based on climate models done by NOAA, University of Hawaii, the Sea Level Center at UH. And 3.2 feet of sea level rise by 2100 is the old number. It's a conservative estimate now based on what they've seen. So many groups are now predicting, as high as 6 feet of sea level rise by 2100.
And that's Hawaii data, not projected from a macro US. Okay,
Correct.
Terrific. Thank you. That's very helpful. Thank you. Thank you, Chair.
Thanks. Rep Poi Poi, go ahead.
Thank you, Chair. So on Molokai, we have a very unique issue of bovine tuberculosis. It was pretty much considered eradicated for a long time, and just earlier this year, I believe we had another outbreak. Just curious if, and I'm sorry if I missed it in the slide, if tuberculosis was specifically mentioned, but if you can shed any light on correlation between climate change impacts and that.
Yeah, that's a great question. I haven't seen that come up in a lot of the reading and information about TB or bovine TB in particular, but we can certainly look it up and see if there's any information.
Thank you.
Great. Any other questions? We haven't heard from Rep Cochran. We did get a question. Rep Kahaloa, Rep Amato. Well, I guess I'll just wrap it up with what do you think are the most important kind of mitigation adaptation measures in response specifically to these public health impacts that we're discussing here today? I mean, is it a need for more data, a need to expand medical facilities to create these, kind of cooling, I guess more, is it public awareness? Like, what do you think are the most important steps that we should be taking from a policy perspective?
I'll just jump in and say all of the above that you noted. I'm a primary care physician, so I would say that, shoring up services for primary care providers, we're kind of on the front lines. So if you have an infection, you're going to try to get into your PCP, you're going to go to the emergency room if you have chronic disease. So making sure all of those basic things are in place to handle whatever might come to us is most important, I think, from my perspective and from a lot of practicing providers, things like that.
And I would add mental health resources as well to that. I think there is already a lot of great stuff going on in storm preparation. We do a great job here already in Hawaii, but a lot of these things we mentioned as well, unfortunately, a lot of the onus may fall on the individual or the family or the community to make some of the, to take some of the actions or recognize some of the problems. So I think the public awareness part is really important. But I think also gathering more data, some of these projects we've talked about figuring out where, exactly what the impacts are to Hawaii and all the work at UH to understand the climate impacts and then sort of the downstream to the health impacts, I think is really important. So
Yeah.
there's a lot of places to make a difference, I think.
And I know this incoming freshman class has made, I think, has said mental health is a priority for them. I mean, for all of us, but I hope we'll see an increased focus with all this new faces we have at the legislature this year, because that's definitely a huge area. Well, I guess we'll wrap it up. We'll probably share the videos on YouTube, and we'll share the presentation if you share it with us, we'll share it with the other members. If we get any follow-up questions, we'll just send those over so people can still have an opportunity to ask questions if something comes up later that you didn't think of in the moment. Yeah, just thank you so much. That was really eye-opening, and it's just important that we think about this climate change in this framework, as well as the environmental impacts and sea level rise and endangered species and all of that. But there's so many ways that these changes affect our lives. So thank you so much.
Thank you for
Thank
having
you.
us and for all the work you guys are doing. And thanks for the time.
Great. Thank you. And everybody, thanks for joining. Okay. Aloha.